Avian encephalomyelitis. The occurrence is worldwide. The clinical form is rare. The etiology of the disease. The avian encephalomyelitis virus is a part of the Tremorovirus genus, part of the Picornaviridae, a uniform virus, and it used to be part of the Enterovirus genus. Picornaviruses are non-enveloped, which means they're resistant. They're small. Pico means small. They only have a few proteins, about 1 to 5. For the epidemiology of the disease, all ages are susceptible. The clinical signs are seen up to 5 weeks old. The disease spreads horizontally and vertically. It spreads horizontally in the feces and it spreads very fast in the environment, and it's taken up through per-os uptake. It spreads vertically too. There's a germinative infection. It does not kill the embryo though. It can be infected up to 3 weeks after the initial infection. Also maternal immunity, which lasts from 3 to 6 weeks. It only infects chickens and pheasants. It can infect turkey and quail as well. They're also susceptible. It has a rapid spread and a high morbidity and a high lethality. Pathogenesis, there's an oral uptake. The primary replication happens in the mucous membrane of the gut, the viremia, and the virus reaches the target organs. The central nervous system is the most important, but it also reaches the liver, the kidney, the spleen, the ovary, and the pancreas. In the central nervous system, we see degeneration and necrosis of neurons. You can see the cerebellum, the brainstem, and the brain and the spinal cord are all affected. For the clinical signs, the incubation period is 1 to 11 days. The clinical signs are seen up to 5 weeks old. Older animals, it's subclinical, but we see decreased egg production. Chicks, we can see ataxia, anorexia, depression, diarrhea, tremors, convulsions, and an inability to stand up. The chicks have a characteristic posture. They have spay leg and their toes are curled. There's a high lethality. All the clinical signs are followed by death. For the pathology, there's no gross pathological lesions because it's mostly a central nervous system disease. For the histopathology, we can see lymphocytic infiltration of the central nervous system, degeneration and necrosis of the neurons. Diagnosis, preliminary diagnosis is enough. So you can just look at the clinical signs, such as the central nervous system, and the epidemiology, so look at the age of the animal. To directly detect the virus, you need to do a PCR, and you can also do isolation with CPE. To indirectly detect the virus, you need to do ELISA or viral neutralization. It's not helpful because the disease is widespread. Treatment, there is none, so prevention is very important. For prevention, focus on the most important, is following the general epidemiological rules, such as preventing the introduction by biosecurity and isolation, and having all in and all out. And if there's an infection, having no hatching for a month. The vaccination, there's a live vaccine in the drinking water. Vaccinate hens 3 to 5 weeks prior to the laying. This gives a maternal immunity. The virus in the vaccine is shed, so vaccinate about 5 to 10% of the flock and the vaccine will spread rapidly.